Good day, Kaalaga! I'm Leia, your future nurse. Today I will demonstrate to you the process of doing range of motion exercises on a client. The definition of range of motion, or also known as ROM, it is the movement of joints through its full range in all appropriate planes that we can do. It has different purposes. First, it is for the maintenance of current joint functions. Second, restoration of joint functions. And last, it is for strengthening the muscles. The benefits of doing ROM is it lessens the stiffness of the bones. It will make the person more flexible and it will give a better posture, reduce risk of injury, and it also improve the joint functioning. The equipments we need are the following: BP apparatus, thermometer, stethoscope, paper and pen for recording. In ROM, it can be done once or twice a day. Do countings where it depends on the capability of the patient. Usually 1 to 3 cycles. 16 counts are equal to 1 cycle. Remember, do not force the full range of motion of the patient if they cannot do it. And stop the exercises if the clients feel sharp and in deep pain. Take note, if the patient has respiratory diseases, we need to monitor their blood pressure and respiration. And ROM exercises should not be performed when the joints are swollen or have inflammation. We have different types of range of motion. One is the active range of motion, 2 is the passive range of motion, and 3 is the active assisted range of motion. Before we proceed to ROM exercises, we need to have a proper positioning and draping. Positioning is a technique of placing the patient safely, comfortably, and effectively in preparation for any procedure, while draping is the manner of arranging the covering to expose body parts that being examined, treated, or cleaned. The purposes of this is to assist the patient to assume positions that would give best adequate examination or treatment of the body part, to provide safety, comfort, and privacy during the examination or procedure. The equipments we need are draping sheet or top sheet and a pillow. Let's do the process in supine position. Assist the client to lie flat on his back. With the legs extended together to afford better muscle relaxation. Place the draping sheet over the client. However, top sheet may use in the absence of draping sheet. Cover the client from the shoulders to foot part with the sheet hanging loose on the side to provide privacy and facilitate changes of position. Put one pillow under the head. And put the arm alongside of the body. To provide comfort and prevent interference during the procedure. Now, let's do the procedure of ROM. First, consult with the physician on the client's medical diagnosis to determine if doing ROM is applicable or contraindicated in the patient's condition. Wash your hands or use alcohol-based hand washing for infection control. Remove your jewelries to prevent transfer of microorganisms. Then identify your patient to make sure that we are carrying out the procedure to the right client. Provide privacy to allay fear and anxiety of the patient by closing the curtains, and closing the door. Explain the procedure to the client why it's necessary to perform to get their cooperation. But if the patient is unconscious, ask permission to their relatives to gain their participation. Good morning, ma'am. Is the patient name is Lex Combaliser?
Yes.
I would like to ask your permission if I can assist the patient to do ROM exercise that will help a better functioning in his body.
Okay, proceed.
Thank you, ma'am. Put the client into a supine position to avoid strains. And adjust the entire bed in a comfortable working height position. Use body mechanics to have an efficient, coordinated, and safe movements in preventing muscle strains to the healthcare provider. Take initial vital signs to have a baseline basis and monitor unjustified alteration that can hinder the procedure. Administer the ROM orderly and sequentially exercise from the neck to the downwards of the body. It should be adequately exercised and reminder to do an applicable ROM based on the client's condition. The following movements I will do preserve muscle tone and joint flexibility. Now, let's start. First is the neck part of the body. Do a flexion. Position your head downwards looking at the toes. Next is the extension. Position your head looking straight ahead. Then hyperextension is position your head looking up at the ceiling. Lateral flexion is moving your head to one shoulder, then the other one. And lateral rotation, move your head, twisting it in a circular motion. Flexion, extension, hyperextension, lateral flexion, then lateral rotation. Let's move forward to the shoulder part of the client. Do a flexion. Raise the arm forward, overhead, and then extension. Return the arm to the side of the body. Then vertical abduction is swinging the shoulder joints away from the body. And the vertical adduction is swinging the shoulder joints towards the body. Take note that there's also hyperextension in the shoulder part. It is extending the arm towards the back. Hyperextension. Now, there's also called internal rotation. It is moving the arm downward. And then the external rotation, it is moving the shoulder joints upward. Flexion, extension, vertical abduction, vertical adduction, internal rotation, then external rotation. Now, let's do to the other side. Flexion, extension, vertical abduction, vertical adduction, internal rotation, external rotation. For the elbow, the movement can be conjoined with the shoulders. Do a flexion by grabbing the hand and then the elbow, bend the arm. Then do extension by straightening the arm. Flexion, extension. Now to the wrist, do a flexion by grasping the palm with one hand and support the elbow with the other hand. Now move the wrist forward and do the extension by straightening the wrist. You can also do hyperextension by extending it to the back. Then the next one is the radial deviation. It's moving the wrist towards the thumb finger, while the ulnar deviation is moving the wrist towards the little finger. And the last movement in the wrist is the circumduction by moving it in a circular motion. Now remember, flexion, extension, hyperextension, radial deviation, ulnar deviation, then circumduction. Now let's do elbow to the wrist. Flexion, extension, flexion, extension, hyperextension, radial deviation, ulnar deviation, circumduction. The other side. Flexion, extension, flexion, extension, hyperextension, radial deviation, ulnar deviation, then circumduction. Let's move forward to the thumbs and fingers of the patient. Do a flexion by bending the fingers and thumbs onto the palm. Flexion, then extension to its original position. Then abduction, spreading the fingers away from each other. And adduction, bring it to close position. Then, circumduction is twisting the fingers, moving in a circular motion. And then the opposition, touching the end of the thumb in each finger in turns. Now remember, flexion, extension, abduction, adduction, circumduction, then opposition. Now to the other side. Flexion, extension, abduction, adduction, circumduction, and then the opposition. Let's move forward to the hip and knee of the patient. Remove the top linen of the patient and then do a flexion by holding the lower extremities and the hip, lifting the leg, flexion, and extension, returning its back to the original position. Flexion, extension. Now, abduction is moving the leg away from the center. Abduction and adduction is moving the leg towards the center. Abduction, adduction. And then the internal rotation and the external rotation is moving the lower extremities inward, then outward. Flexion, extension, abduction, adduction, inward rotation, external rotation. Let's do it to the other side. Flexion, extension, abduction, adduction, internal rotation, and external rotation. For the ankle, do dorsiflexion by cupping the heel of the client and moves it upward. And then plantar flexion, pushing the ankle downwards pointing toes. And the last movement is the circumduction by twisting the ankle in a circular motion. Dorsiflexion, plantar flexion, circumduction. Now to the other side. Dorsiflexion, plantar flexion, circumduction. These movements helps maintain ankle flexibility to prevent foot drop. For the toes, do flexion and extension. Bending the toes downward and upward. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. After doing the range of motion in the lower extremities, return the top linen to the patient. I will do the spine ROM because my patient is unconscious. First, do extension by standing straight. Then flexion by bending forward from the waist. Then hyperextension by bending backward from the waist. Next is the lateral flexion by bending towards to the side of the waist. First is left, then right. The last movement is the rotation, twisting your waist in a circular motion. Extension, flexion, hyperextension, lateral flexion, then rotation. After doing ROM exercises, wash your hands and use alcohol-based hand washing. Keep your patient in a comfortable position to provide rest because ROM is a tiring one. Evaluate the other needs of the client and document any unusual circumstance observed. I hope I delivered the procedure clearly. Once again, Kaalaga, your future nurse, Love, Leia.